Cercherò di convincervi del fatto che
Sometimes people believe that the healthcare system, care and increasing number of older people are a weight, a burden for our society. But we are persuaded that the reality is different. It is actually the opposite. They represent a great added value for our society. Aging, becoming old,
considerazione invecchiare
is of course better than not being able to age.
qualcosa di meglio del
So this is a basic consideration that should also be seen in economic terms. An aging society is not a society that becomes more cumbersome. It is a society that becomes richer in terms of experiences, values, but also in economic terms.
valori, ma anche
I have borrowed, so to speak,
ho preso
a picture, a painting that is called
qui state
after the street that leads to the main entrance of the building that we're in today, the European Parliament. This painting is quite provoking, and it is called Deux jeunes filles, two young girls, and it tries to combine two extremes, so fertility, beauty with death.
l'utilità della bellezza del positivo come
So these are two sides of the same coin. Life is like that. And the European society is also undergoing this change. And it brings about two different aspects. The cost of supporting high quality services, advanced services, what we are trying to do and what is more and more required, but at the same time we have more value, and this is what I would like to focus on now. First, some figures.
prima alcuni dati.
Well, this graph shows the population, the demographic changes in the European area. The statistics are really updated, and it shows the number of over 65 plus people from 2004 to 2012. You see that the numbers have doubled, and this trend is going upwards. That is the percentage of 65-plussers, the percentage in terms of workforce, people between 20 and 64 years of age. The percentage changed from 26% in the year 2000 to 31% in 2012. And even this percentage is on the rise. So that means that the working force is trying to support the weight of older people. This is the positive aspect, life expectancy. We just picked a country because the data are not homogeneous in Europe. You see that in Italy from 2000 to 2011, life expectancy at birth increased from 80 years of age to 83 years of age. This difference seems a minor difference, but if you consider the general population of the country, the difference is quite considerable. And you see that this trend also sees some peaks and some considerable increases over time. This is another aspect that connects our work in terms of social reporting with the idea that I'm trying to convey, and which says that it is all about investing. The healthcare system is not just a matter of costs, it is a driver for our development. So you see how many jobs, how many employees find a job in the healthcare system. From 1998 to 2010 in Italy, the total number of people working in the healthcare system increased from 1,250,000 to almost 1,700,000, and the numbers are on the rise. These are jobs, stable jobs. You see that healthcare system organizations have often open-ended contracts, so it is really a source of employment and income for the population. So we have other data. You see here healthcare workers.
Questi sono gli operatori d'assistenza.
We have updated our data, and this data concern Spain that has provided the OECD with many figures. We're not talking about nurses or about doctors, so we're talking about healthcare system operators. So we're talking about people who have been specifically trained and they provide care to the disabled, to people who are experiencing chronic illnesses. You see that in Spain there was an increase from about 200,000. We have now more than 470,000 workers. So the numbers have more than doubled, and this trend will even continue to increase in the future. So that means that this is a booming market. It is expanding. If we had to make a comparison with other sectors, we would see that this sector is developing, it is flourishing and booming, and this is a very important aspect of our economy, because it provides stability and even more resources. This is a further example that we have extracted from a social report of Bologna, of the Bologna province. We have aggregated some data for healthcare companies and social companies. The data concern 2012. If we have an added value of 126 million euros, well, 75% has been reallocated, redistributed amongst workers. This is a great example. There are no other economic activities that are capable of redistributing such an important amount of money, such an important added value amongst the workers. If we take the manufacturing industry, the data are reduced by a third. So that means that the amount of resources that public or even private institutions invest in care for the elderly, for 3/4 is given back to the workers in the form of salary and wages. So the companies keep about 10% for amortization and investments, and public administration, i.e. society, in the form of taxes, recovers 11.22%. Then we also have banks for interests, and then 1% is only given back to the shareholders. You see this graph, and this graph can also be applied to the module of European healthcare organizations. This is why we like to talk about strategic investment and added value in the healthcare and social sector, because for every euro invested, money which supports people in need, wherever you're invested gives back resources in terms of wages, taxes, and it supports the economy. There is also a Spanish study that was presented last year, and it demonstrated that for every euro invested, public administration after 12 months recovers 1.13 euros. So that means it is not a cost, but it is an investment. Let's move on, and I'm about to conclude. And I'd like to conclude by quoting George Bernard Shaw. If we do not change our minds, we will never be able to achieve any change. We will not be able to change anything. So care and assistance to the elderly and to the sick people are not cost. It is a form of investment in dignity, and also in economic terms, they are important instruments capable of fueling our economy. Thank you.
What are we focusing on? There is an introduction, there's a letter of the chairman that takes into account what has already been said at the beginning of this event. And there's also another part in which we explain what the objectives are, what the rules are, the principles that have to be followed so that we can develop these social reporting exercises. So the principles are really fundamental because in any case, as always in the accountancy world, if there are no specific and clear and shared principles at the beginning of this kind of exercise, well, this can lead to all sorts of problems. You can make different choices, etc. So, which is why principles are really fundamental. You really have to work and start, let's say, from the principles. So, these principles are linked to the international guidelines that have been developed in the accountability and social reporting and sustainability reporting world, which is the Global Reporting Initiative, GRI. This initiative is an ongoing standard, let's say, and it's the most followed by the companies, the biggest companies in Europe, all the major listed companies. So these principles, of course, are internationally followed, and they can also be taken into account in our sector. So what are these principles? Very briefly, there are two categories. First of all, the principles for defining the contents, which is actually what has to be taken into account during the reporting. And then on the other side, there's also the principles that define the quality of the information. So in the first category, in the first group, which explains how to identify the relevant information that has to be measured and taken into account in the report, well, we have different elements like the stakeholder inclusiveness, already been tackled by Mr. Carrone. This is a very important element. This inclusiveness is a very important concept, which means that you cannot forget some stakeholders. Everybody has a voice to be heard, or sometimes they don't even have a voice to be heard. So you have to make an extra effort to listen to what they have to say. So this is really a question of responsibility, because unfortunately we know that in our societies there are always groups and people that don't really have a strong voice and are not heard. Then there's another element, context, the sustainability context, because sustainability is completely different in Europe compared to what it is in Africa, for example, or in the Middle East. So according to the social economical context, the legislation, the policies, well, we have to understand what the information, what the relevant information is. And then there's also the completeness, which is quite traditional in the context of accounting. And I would like to focus on this element of materiality, which is quite complex. Well, the information is material when it's significant for the company and for the stakeholders. So when we talk about this element of materiality, well, it takes into account the needs of a company, but also the interests of the different stakeholders, and mostly the way in which the information can have an influence on the judgment of the